Good morning. Beautiful day here in Prince Edward Island. Across the country, there are more than 93,000 cases of COVID-19 and more than 7,400 deaths. But the number of cases in the past 7 days in Canada is actually over 23% lower than the previous 7 days. And the trend in deaths in Canada are following the same. They are 18.7% lower in the last 7 days than they were in the 7 days prior to that. So those are good signs. No new cases in Prince Edward Island, and we continue to test over 250 people since Tuesday, and those tests are negative. I'd like to just go back to what we've been talking about all the way along in terms of our public health guidance, because they are really important. As we go forward through these phases, we need to be informed and be prepared and try to follow the advice as best as possible. Maintaining physical distancing of 2 meters or 6 feet if you're not part of the same household, adhering to gathering limits, staying home when you're sick and calling 811 or your family doctor to try to get tested. The testing, as I mentioned, very important as we go forward. Washing our hands often, soap and water for at least 20 seconds. And if not available, using a hand sanitizer that has 60% alcohol at least. Don't touch your face with unwashed hands. Cough or sneeze into a tissue or your sleeve, and limit personal non-essential travel. And self-isolation is so important, and we're getting questions all the way along about whether people need to self-isolate. So whether you were returning from essential travel, returning home, whether you're in P.E.I. for compassionate or exceptional reasons, self-isolation is very important as a public health measure. We've had some questions surrounding the New Brunswick essential worker exemption being removed earlier in the week. And this means now that essential workers traveling in New Brunswick must go through the same process as other essential workers leaving the island. For essential workers who travel off island for a delivery or pickup and do not make stops for non-essential things, they are not required to self-isolate upon returning to the province if they return that same day. And this is similar to those traveling off-island for a medical appointment. In order to prove same-day travel, they need to keep a copy of the bridge receipt and be able to show this upon re-entry to the province. And examples may include farmers who may be going over to pick up a piece of equipment in New Brunswick, or a trucker dropping off a load of gravel. And for same-day medical appointments, individuals must show proof of the appointment. It's also a reminder that although essential workers must travel in and out of Prince Edward Island, this should be done for the purposes of essential work. Our office has been posting guidance documents on the web as they are completed, and I mentioned many of them before, but the topics are wide-ranging, from campgrounds, carpooling and essential transport, commercial fishing, day camps, fitness facilities, funeral homes, retail, sport and recreation, swimming pools, and we anticipate the fixed roof accommodation guidance working with tourism to be available later today. These guidance documents are helpful tools to assist businesses and groups to create operational plans, and a reminder that operational plans must be in place. And it may seem odd to talk about singing and yelling as a high-risk activity, but when we're dealing with a virus and an illness that is spread by droplets, it is something we need to talk about. Singing, yelling, musical instruments that can cause droplets are of higher risk. So if entertainment is happening with singers, wind instruments, and or brass instruments, it's important that everyone is 12 feet apart from one another and from anyone who may be there to listen. We are now a few days into phase 3, and I know many islanders are pleased to have businesses and services more available. But I want to encourage islanders to continue to be cautious. If dining out, it is actually best to do so with members of your own household. And if you are with members from another household, beware of the additional risk. It's especially important to consider the health of those who you're dining with, and remember that takeout and delivery are still options. It's extremely important that we practice physical distancing, washing and sanitizing our hands, and staying home if you are sick. And it's important that we remember that the gathering limits are still in place, 15 indoor and 20 outdoor, and larger gatherings are not permitted at this time. I've mentioned it here before, and I'd like to mention it again. It is, we really want to work on family reunification, and that's across the country. And we're trying to look at how we do this safely and in stages. We know that there are children who want to come home to see their parents, grandparents who want to see grandchildren. As we continue to go through each phase, we need to look at what our capacity is for follow-up, as well as testing. So we will have more details in the days ahead about how we can address this. But first and foremost is keeping islanders safe and trying to figure out how we can have some of the family reunification in a safe way as well. We all have been impacted and have had unintended impacts of COVID-19. Our children, students, some people have lost jobs, some people have had to close businesses. We have had families who've struggled with shared custody. Parents have been impacted, seniors, those who have been living alone, and those with mental health issues. Our healthcare workers and essential workers have all been impacted. But I am hopeful as we go into this phase 3 and forward. We are having decreasing rates of COVID-19 in this country. We are opening up, and we are trying to be careful. So as we head into another weekend of change, where more options are available, I'd like to remind everyone to be diligent and continue to be diligent. The basics become more and more important as more restrictions are relaxed. Gather in small groups, but stay 6 feet apart. Go out for a meal, but go out with those from your household if possible, and respect the measures that the restaurant has put in place. Take your kids to the park, but use good hygiene practices and keep your distance from others. It is a balance between doing the things that we love to do, but doing it differently, and how we approach these things thoughtfully and cautiously to protect one another. So let's be careful, level-headed, let's be patient, be safe, and be kind to each other. Thank you.
Je vais juste mentionner quelques mots en français. J'ai pas vraiment les notes en français aujourd'hui, mais aujourd'hui, il y a plus de 93 000 cas de COVID-19 au Canada et plus de 7 400 morts. Mais le numéro de cas dans les 7 jours qui sont passés sont 23% plus bas que les 7 jours en avant. Alors, c'est une bonne signe. On continue de faire les tests ici à l'île du Prince-Édouard. Et c'est tellement important vraiment de continuer de faire des mesures de santé publique. Garder la distance de 2 mètres, laver les mains, rester chez vous si vous êtes malade, ne touche pas votre visage si vous ne lavez pas les mains, et ne voyagez pas si ce n'est pas essentiel. Et à propos les travailleurs qui vont à Nouveau-Brunswick, il faut maintenant quand ils sont au Nouveau-Brunswick et retournent, ils suivent le même sorte de processus que n'importe où. Mais s'ils font des voyages pendant la même journée, ils n'ont pas besoin de faire le auto-isolement. Et puis, les exemples sont quelqu'un qui cherche, un fermier qui cherche quelque chose, équipement pour la ferme et retourner même journée. Ou si vous avez quelque chose à faire à l'hôpital au Nouveau-Brunswick, mais vous allez retourner même journée, vous ne devez pas aller en auto-isolement. Mais on a encore les documents pour guider les business ici à l'île du Prince-Édouard. Ils sont sur le web. Et il faut faire attention si vous êtes en train de chanter ou jouer les instruments. Et si vous en faites, il faut garder au moins 12 pieds entre les autres chanteurs ou de quelqu'un qui vous écoute. C'est parce que c'est le virus, c'est la maladie, c'est transmis en particulier par les droplets qui vont plus loin quand vous chantez ou criez. Aujourd'hui, on est plusieurs jours entre la phase 3 ici à l'île du Prince-Édouard. Alors, il faut faire attention, de continuer de faire attention à ce qu'on fait ici, de garder la distance, d'être en groupe qui sont assez petits si possible. Et on a tout bien fait jusqu'à date, mais on veut qu'on soit encore diligent et faire attention dans les jours et les semaines qui suivent. Alors, soyez gentils, soyez prudents et merci beaucoup.
Thank you, Dr. Morrison, and good morning, everyone. Health P.E.I. continues to reinstate services to the most appropriate level we can while remaining ready to respond to an outbreak. The Services Reinstatement Team has reviewed and approved many plans for easing back of health services across our sector. This includes rebooking surgeries that were delayed due to COVID-19 and other essential services that have been continuing. In total, for surgeries, we've had 1,120 procedures that were delayed. This week, additional Health P.E.I. services have been reintroduced, and some of those already opened have increased their volumes as we continue with our phased approach. To provide an example, in May, we had 517 surgeries completed, and before COVID-19, our average number of surgeries was between 700 and 900 in a month. So that means in May, we were at approximately 2/3 of our usual surgical activity, even as significant restrictions remained in place. In service areas such as diagnostic imaging, where we saw significant cancellations due to COVID-19, we're now nearing our regular service levels. Many of our services must now operate in the new reality due to the pandemic, and we've had to space out appointments in service areas, and some that were formerly walk-in are now scheduled to allow for physical distancing. Staff have stepped up with augmented schedules to allow longer working shifts or days for services like diagnostic imaging to spread out the volume of people who would be attending at any given time. I want to thank all of our staff and leaders across our health services who've really been working tirelessly to provide these services when they were listed as essential, but also now in being creative in the ways to efficiently and effectively offer more services as quickly as possible. COVID-19 has changed the way we deliver health care, and some of these changes will be with us for a long time. I'd like to thank Islanders for your patience with our staff and our clinicians as we continue to work through this pandemic. As more services are reinstated and more surgeries and procedures are completed, we will be sharing that information here and online on the Health P.E.I. website. We have been hearing with the reinstatement of some of our services that certain people are anxious about going to their appointments or procedures because of COVID-19. Please know that appropriate precautions are in place to ensure our hospitals and health centers are safe. Attending your appointments and getting your procedures is important to your health, and be assured that you are in a safe place for care. With Dr. Morrison and her whole team and our leaders across the health system and government support, we have done very well, and P.E.I. is a safe place to be. If you do have concerns about your particular procedure or care that's being provided, please discuss those with your healthcare provider, but we do hope you come for service. Again, a reminder that if you are being rebooked for appointments or procedures, you will be contacted by Health P.E.I. or your care provider directly, and there's no need to call to book your appointment. Thank you.
Thank you, Marion, and I'll open it up for questions.
Julian Lechasseur, Radio-Canada.
Bonjour, Dr. Morrison. Dr. Morrison, depuis lundi et la réouverture des restaurants, les restaurants demandent à l'entrée souvent le nom, le prénom, les numéros de téléphone. J'aimerais savoir, Dr. Morrison, quelles sont les règles exactes. Qu'est-ce que vous avez demandé aux restaurants concernant les informations réclamées aux insulaires? Et ensuite, qu'est-ce que vous faites de ces informations-là?
Alors, bonjour Julien. On a demandé s'il peut garder le numéro et le nom de au moins une membre du groupe qui mange ensemble au resto. Ils gardent au resto eux-mêmes. Et c'est seulement en cas, si on a quelqu'un qui devient malade, peut-être une des personnes employées qui travaillent au restaurant à COVID-19, on peut contacter les gens plus facilement et puis on peut les appeler et puis qui est autre avec qui vous avez mangé parce que vous étiez exposé à quelqu'un qui a COVID-19. Ou peut-être, c'est pour l'habilité de faire les contacts avec les personnes qui mangent. Et c'est pour cette raison, et puis il garde pour quelques semaines. Et puis, c'est parce qu'on pense que si quelqu'un devient malade, c'est seulement dans les prochaines semaines. Alors, j'espère que ça répond à votre question.
Juste pour confirmer, Dr. Morrison, donc vous ne récupérez pas tous les noms et tous les numéros de téléphone, vous reprenez uniquement que ceux des gens qui pourraient être malades et ensuite vous me confirmez que les restaurants ont l'obligation de détruire ces informations après quelques semaines?
Oui, je pense qu'on a demandé d'en garder le nom et le numéro pour jusqu'à un mois, juste en cas que quelqu'un devient malade au bout de 14 jours et puis on doit faire les contacts. Mais on ne les voit pas, on ne va pas les utiliser si on n'a pas besoin de faire les contacts.
Parfait, merci beaucoup.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you both. Dr. Morrison, une question en français pour vous par rapport à l'opération isolation. Maintenant, avec l'arrivée des résidents saisonniers, il va y avoir beaucoup de monitoring à faire. Je me demandais quel est l'état de vos ressources actuellement? Combien d'employés vous avez qui font les appels et est-ce que, à votre avis, c'est suffisant pour l'influx de résidents saisonniers qui vont commencer à arriver à partir de la semaine prochaine?
Bonjour. Je pense que les opérations isolation sont à peu près 20 personnes à ce moment, et puis ils s'organisent et s'entraînent pour s'assurer qu'ils ont assez de capacité pour mi-juin et après. Alors, ils se préparent et à ce moment, ils sont, je pense qu'ils en ont assez. Et si le nombre va changer, on va augmenter la capacité.
Un follow-up à ce sujet-là, si possible. Des gens qui arrivent aux frontières, il y en a plusieurs qui donnent un numéro de téléphone cellulaire comme contact principal. Ça ne permet pas nécessairement de vérifier si ces gens-là sont isolés à la maison au moment où on les appelle. Est-ce que vous pensez que c'est une méthode suffisante pour vérifier que les personnes s'isolent bien?
Je pense que la majorité des personnes vont suivre les règles et les mesures en place. Ils ne veulent pas qu'ils sont responsables de transmettre l'infection à leur famille, à leurs voisins, à la communauté. Il faut se souvenir qu'on est vraiment la seule province qui essaie de faire ça avec les gens qui arrivent de n'importe où. Alors, on doit respecter aussi les gens qui on a besoin d'avoir son privacy des privés, mais je pense que la majorité des personnes suivent les règles de auto-isoler, et puis je pense qu'on on fait notre mieux de demander les questions et je dois avoir confiance dans les gens, confiance dans les insulaires, confiance dans les résidents saisonnières qui vont suivre les mesures qu'on a mises en place. Et parce que l'autre façon est de ne pas les appeler, mais c'est quelque chose qu'on essaie de faire pour communiquer l'importance de auto-isoler, pour aussi savoir si ils ont besoin d'autres supports pendant le temps de auto-isoler.
Merci beaucoup.
Laurent Rigaud, Le Voir.
Bonjour, Dr Morrison. J'avais une question sur ce qui se passe en ce moment au Nouveau-Brunswick. On voit que vous changez un petit peu les règles pour l'isolement suite à cette éclosion. On vient d'apprendre qu'il y a eu le premier décès au Nouveau-Brunswick de la COVID. Est-ce que ça va changer quelque chose pour les discussions sur la bulle des maritimes dont vous parliez encore il y a quelques semaines?
Bonjour. Non, je ne pense pas que ça change pas les discussions à propos de la bulle, mais c'est juste pour s'assurer pour quelques semaines qu'on voit que l'explosion des cas ou l'outbreak des cas au Nouveau-Brunswick est bien contrôlée. Et puis, ça a l'air comme ils ont fait les tests, ils ont fait beaucoup de contact tracing. Alors, la discussion et les plans regardant la boule ne changent pas à ce moment.
Juste un follow-up alors sur cette question. Est-ce que aujourd'hui votre objectif c'est d'avoir cette bulle en juillet, en août? Et comment est-ce que vous le sentez?
J'espère que ça va être peut-être le 1er juillet, mais je vais en parler avec mes collègues, mais c'est aussi entre les premiers ministres qui ont cette discussion. Mais
J'imagine que c'est quelque chose qu'on va en parler un peu plus la semaine prochaine et j'espère avoir une date. Et peut-être les premiers ministres vont annoncer, mais je sais que c'est une discussion qui est encore active.
Merci.
Okay, yeah. Hi, Louise. Just before I take your question, I just thought I might translate a couple of those for folks. One of the questions was about contact tracing at restaurants. So we've asked restaurants to take the name and phone number of one person in the party or one person in the household, so that if there was a case of illness at the restaurant identified and we had to do contact tracing, we'd be able to reach out and try to do that contact tracing more easily. There was also a question of the capacity of the Operation Isolation callers, and at this point in time, we feel that there is capacity. There's, I believe, 20 callers at this time, and they are certainly preparing and training for the days and weeks ahead. And if that if we need more capacity, we'll get more capacity because it's a really important thing that we're doing. The follow-up question was around, we have sometimes cell phone numbers, and is that enough? Well, we need to trust people, certainly. The majority, by far, the majority of people are self-isolating, and we think it's really important. And I know that no one wants to be responsible for infecting their families, infecting their neighbors or the community. So we are doing this. This is a measure that we're putting in place in this province that we think is important, that isn't being done in many of the other places. So we think it's something that we wanted to do. It's also a chance to emphasize the importance of self-isolation, as well as offering support if people need support during self-isolation. So I think it's, of course, it's not a perfect system. We have to respect certain privacy aspects of this as well, but we are doing something that is an extra measure, and that we've had good success, and by far the majority of people are following this, and I would expect that to continue. So sorry, Louise, I just wanted to highlight some of those other questions in English.
No worries at all. No worries. Sorry, I didn't hear you say that at first. So yeah, I'm just wondering for an update, if we have an update on how many seasonal applications have come through, how many perhaps have been approved, and when might we see people arriving here?
Hi, Louise. So I don't have an update of numbers because those applications do go through Justice and Public Safety. So I will be speaking with them this afternoon. I think when we spoke on Tuesday, there had been over 800 at that time. I expect that number probably has gone up. We've said before that we wouldn't expect anyone to be here until after June the 15th. So I don't have any further details at this point in time, but we've mentioned before that it would be the seasonal residents would be from Nova Scotia and New Brunswick to start with.
Okay, thank you. And I'm just wondering, there have been a lot of questions in the House this week about what school might look like in the fall. I know we can't be super specific because it's early days yet, but is it safe to say physical distancing will still be in place in September? And if so, what modifications should be happening now to ensure that there could be in-class learning?
Well, Louise, I think students are thinking about it, teachers are thinking about it, principals, and right across the board. And my understanding is that there's going to be a lot of planning and discussion, not only within the province, but looking across the country, because
all the provinces and territories are looking at exactly the same thing in the next few weeks, because I think they'd like to get a good sense of what this could be before the end of June, so that they're not trying to plan in September. And so I don't really have, as you said, a lot of details about what that could look like, and I think they're exploring some of the practices. I think it is safe to say school will look and feel different than it has in the past, and I think our students are even thinking about that now, and I'm thinking about my own children have come up with a range of ideas of how it might look, and like everyone else, they've given me some suggestions to take forward. So it will, physical distancing, hand hygiene will be important, how we screen our students, how we move in schools. I think that will all be impacted. How it will impact buses and busing, how it will impact the cleaning in the facilities, what parts may be done online and what parts may be done in class. So there are a lot of questions at all levels of schooling, so I think really important discussions to take place in the coming weeks.
Thank you very much. Appreciate that.
Jessica Dwyer-Brown, CBC.
Hello, Dr. Morrison. My first question is for you. You mentioned family reunification, and I know you said that we should have some more details in a few days, but obviously it's top of mind for a lot of people. Just wondering if you can elaborate a little bit at this point on kind of what considerations you're weighing and what you could say at this time about what that might look like, that family reunification, and how it could work.
Hi, Jessica. I mean, I've said right along that it's really important. We recognize it. We've have family who live here, who have loved ones who live away, and trying to figure out how they can be together. And so it would involve self-isolation. It will involve likely testing, so it'll be some of the same measures in place, but how we figure out how the numbers look and what our capacity is at any particular time. Those are some of the things we're going to have to look at, and but recognizing this is something that is important for all of us for lots of reasons, and that connection is extremely important. So looking at that, and also in combination with just lifting restrictions in interprovincial travel that are, when we talk about a bubble, that is part of that discussion. So I really don't have much more in terms of any details, but to highlight it, that it is something that we have talked about before, we continue to look at, and we'll see how we can do it in a safe way, as we have all the other steps we've taken as we continue on in this post-phase, post-wave one, I guess, of the COVID-19.
Okay, thank you very much. And my second question is for Marion Dowling, just concerning the surgeries you mentioned. Just wondering how long it could take to clear the backlog. We're back to near regular levels in some areas, but that doesn't address all the procedures that were canceled and need to be caught up on, of course. Are there additional hours and shifts and people working, say, more weekends to address this?
Hi, Jessica. Yeah, I think it will take some time, and we recognize that prior to COVID-19, we had certainly wait lists for certain types of procedures. So we are looking at different ways of ramping this up, but you have to do it in a planned approach. And as you heard me also mention, as we are hearing from some islanders that they're concerned about coming for their procedures. So we are trying to work together with everyone to make sure those individuals who need their surgeries done first are able to access those. So having the clinicians and the surgeons review their lists and prioritize their patients and to approach that. We have done some of the additional hours and things, as I mentioned, with diagnostic imaging, so people will be getting or have been getting calls for appointments at non-regular hours from what we used to offer in some of those service areas. We haven't gone to that yet with our surgical services because there are a lot of impacts for post-surgical care, pre-surgical testing and ramping up, and the whole system has to work together. So it is complex to make those things happen, but that services reinstatement team I know has a particular focus on the surgical services as one aspect, as a priority, to ensure we get those ramped up and try and put additional measures in place to do it as quickly as we can. And we've been fortunate here to be able to restart some of those things sooner than some other jurisdictions, but there is a catch-up to happen.
And just kind of a quick follow-up. Any idea at this point how long it could take in terms of catching up and getting back to regular time frames for those surgeries?
Honestly, I don't know, because it depends on how well we continue to do, what kind of resources we can have in place for additional procedures, what kind of spacing we can have in place, how the other services can continue to provide the other kind of ancillary supports around these patients who need to have procedures done. So I don't have a time frame for you today, Jessica, but that team is working on a plan to map that out. So as we have more information, I'll certainly share it.
Okay, thank you very much.
Allison Jenkins, Guardian.
Hi, good morning. My question is about the Premier's grad committee. I realize he's not there, but with the guidelines that are coming out for other activities, has this, where's this in the lineup? It's getting on graduation time and there's people planning things. So what's the latest on graduation and best practice?
Hi, Allison. So I believe the Deputy Minister of Education was meeting with different people involved with graduation even this morning, so or with the school system to discuss graduations. So I think graduations will look different as everything else has also looked a little different this year, but recognizing it's people want to mark the special occasion, and it's an important milestone for students, and so I think there will probably be more details out of the school system as well as the department, because they have been talking about it this week.
Okay, thank you very much.
Stu Neepy, Guardian.
Hi, good afternoon. A question to Dr. Morrison. I guess in talking about family reunification, there has been a family that's been in the news where there's a mother who's been separated from her 18-year-old child because the grandparents who are currently caring for the child are Newfoundland residents. They have applied to enter as seasonal residents, but one of the restrictions is that somebody must have a fixed roof structure that they were planning to self-isolate within an Airstream trailer. Why was there a restriction on things like trailers? Why was there a requirement for a fixed roof structure on kind of a property where people own?
So I'm not aware of the details of the case you're discussing. But in terms of seasonal residents, I think in terms of it being a fixed, I think it was also that if someone was just going from place to place in a trailer, then that wouldn't be quite the same thing as someone who was planning to come here and stay for a long period of time, and ability to self-isolate, things like that. So that would be part of that
discussion, and when they are looking at seasonal residents, some of the numbers are also based on people paying taxes on residences here, is my understanding, and of course that's some of those details were not from a public health point of view, but so I'm not sure I'm able to totally answer that question.
Okay. And I guess just on another topic, it seems pretty likely we'll see a rally of some sort connected to some of the activity down, well, in other cities in the United States. So, you know, people still have civil rights here. This gathering might be more than 20 people, but I'm just wondering if you have any sort of recommendations or guidelines for people who wish to sort of express their civil rights in sort of a rally or a protest at this time.
Stu, a great question, and we've seen that across the country, and recognizing that racism is a public health issue, and it's really about giving advice. I think in Canada, some of the rallies that have been held, a lot of people wearing masks, which is really great. So I'd encourage people to wear non-medical masks, to try to keep physically distant even when they're gathering. And again, we were talking about when they're rallying, that there's not, if people are yelling, then it can spread the virus differently. So how do you make noise and be able to express yourself in a safe way? So I think it's really just to support the use of non-medical masks, physical distancing, and absolutely recognizing that the voices on this matter, on this issue, are important.
Okay, thanks so much.
Rachel Collier, Eastern Graphic.
Hi. My question, I think, might be best answered by Marion. And the question is, with ambulances posted at the Wood Island Ferry Terminal, testing truckers, how many are available to respond to emergencies in Kings County?
That's a good question, Rachel. I think that the paramedics that are working in the ambulances at the Wood Islands Ferry are also going and doing other work between those ferry runs. We also have community-based paramedics who are not part of the emergency call list, and that's my understanding. Now, Dr. Morrison may have something to add, but that my understanding is it's those community paramedics who do other scheduled calls and visits as part of our mobile integrated health program with home care that are doing those testing, and those are scheduled crossings as well. So I don't believe there's an impact to the number of emergency vehicles able to respond to any emergency in Kings County, but yeah.
Community-based
Yeah,
paramedics.
so I don't think there's been a change to that at all.
Response time, but it sounds like you've kind of answered that already.
Yeah, no, it shouldn't impact the response time as far as I'm aware.
Okay, thanks for that.
I think that's it. So thank you very much, and enjoy the next couple of beautiful days in Prince Edward Island.